Medical professionals of Reddit. What's the worst piece of advice your patients have gotten from Google? Story 1. A 2-week-old infant was admitted to my hospital with severe jaundice, which at birth is normal. The mother, though, hadn't been breastfeeding the child because she read on the internet that breastfeeding is bad for babies. She decided the next best thing to do would be to feed the child a mixture of cornstarch and water because formula was too expensive. Baby lived. Magically, people, though, man, edit yes, social workers and child protection were involved. Story 2, almost as bad as Google, is military doctor. Hey, race an ibuprofen for that broken leg. Oh, you have kidney stones. Hey, race an extra strength ibuprofen. Story 3, I could write an essay on this. Any herbal supplement bullocks. For an example, when you first get out of school, you have to put many hours in, specifically at health clinics. You have no idea how dumb people are. One guy said he saw online that taking a knife to his goiter and draining it and cleaning it would be a good idea. Drinking sugar water with salt to make Gatorade would help with electrolytes that would help his high blood pressure. I can go on. Suppose the worst was a man with dementia and was told that he had to spend $5,000 for a prayer to cure him. They did it twice to him because he forgot he gave the first time. My good friend in college once showed up randomly at my dorm in the middle of the night, freaking out because she thought she was having a miscarriage. This was a surprise to me because I knew she had been on her period recently. So I asked her when she found out she was pregnant. She gave me a blank stare and then said you have to be pregnant to have a miscarriage. I guess she had just Googled her symptoms, bleeding and abdominal pain, and settled on the first result without reading anything about it. The kicker was that she was really smart otherwise. I have no idea how she had never heard of miscarriage before. Story 4, I'm a pharmacist, and I used to work in a large retail pharmacy. An older couple came in to pick up a prescription for tamoxifen, which blocks the ability of estrogen to stimulate breast cancer cell growth. As I'm ringing them up, they ask which aisle can they find vitamin C in. I asked them some further questions, which reveals that they read online that vitamin C could treat and prevent cancer, and they wanted an additional remedy so that the wife would not have to take her medication and would never get breast cancer again. It was kind of sad, actually. Story 5, a couple had just had a baby. Discussing contraception and postnatal period, they said they had been using the pill. They said they had been very compliant, and they couldn't figure out how they'd gotten pregnant the first time. Guy pipes up and says, yeah, I take it one day, and she takes it the next day. Total cluelessness. I suppose in their defense, there's a certain logic to it. Story 6, my boyfriend and I joke that his mother has an MD from the Dr. Oz School of Medicine, with a specialty in WebMD and answer searching. You think of a quack treatment. She'll tell you how it can cure my boyfriend's Lyme disease. She's all about detoxifying. Raspberry ketones, lemon juice for curing cancer, high-dose vitamin D, colloidal silver, salt caves, vitamin infusion therapy, Himalayan salt lamps, essential oils, burning sage to ward off evil spirits, Epsom salts. Her latest craze is hyperbaric oxygen therapy to cleanse toxins and heal brain damage. Never mind that HBOT is not FDA approved for brain conditions and has not been shown to be effective for TBI or brain damage, or that toxins are the ill humors of today's medically uneducated masses. They told my boyfriend that the HBOT makes his skin absorb oxygen, which is important because the skin is the largest organ and oxygen is our most vital element because we're over 60 oxygen by weight. Pretty sure if cleansing the body with oxygen absorbed through the skin was a thing, we would have evolved without lungs or kidneys and livers. But what do I know? I'm only an engineer, not a doctor. In any case, my boyfriend has been feeling worse since starting HBOT. Story 7, vet here. Where to start feed your dog cat a homemade raw diet. This one has been so thoroughly disproved it's not even funny, but the myth just won't die. Grains cause allergies. No, they don't. The overwhelming majority of food allergies are caused by animal protein sources. The snake oil, du jour, being pushed as a panacea. Sometimes it's coconut oil. Sometimes it's apple cider vinegar. Sometimes it's oatmeal. Sometimes it's Bach flowers. What all those things have in common is that they're presented as a cure-all for a variety of unrelated conditions, and that they don't work. Treat your reptiles for mites by dousing them in olive oil. All you're going to get from that is an oily iguana. With mites, you need to crop a pit bull's ears because they will all get ear infections if you don't. Seems to be a strangely breed-specific thing. Rat poison can't kill your dog because your dog is not a rat. Really, the most common Google thing, though, is that people vastly overestimate the importance of symptoms for the diagnostic process. Symptoms are useful to decide what test to run, but they are not generally enough to make a diagnosis. The same symptom can be a sign of a variety of diseases, and your pet will need further exams in order to narrow it down. You can't just feed symptoms to Google and get anywhere near a diagnosis. Edit because people are asking. I added a peer-reviewed review article showing the scientific consensus on raw food. Edit 2, thanks for the shiny, much appreciated. Edit 3, as usual. Quite a few commenters are arguing that they fed their dog cat X, Y, or Z and never had a problem. If you argue like this, you obviously agree feeding something and observing the result has merit. Now, why would you think your N1 uncontrolled trial is better than the controlled trials on hundreds of animals that are behind the review article I linked? Story 8, bloggers complain that kids can't get aspirin from the school, but they can get IUDs without parental permission. Well, no, don't give aspirin to kids, cough suppressants, when you have a productive cough. This belief that antioxidants are magic, they can actually interfere with a lot of chemotherapy agents that work by oxidation. Edit number 1. Number 2, stopping a productive cough keeps everything in your chest. You want to cough it up. Number 3, clarification. I'm talking about high mega doses of antioxidants. There's a lot of variety in cancer types, chemotherapy agents, and types of antioxidants. Keep that in mind. Story 9, on behalf of my sister, when I had my ileostomy bag, like a colostomy, but for your small intestine, and by had, it was reversed in 2012 and my intestines are complete now. -3 feet, there was a blockage. A blockage is extremely painful as nothing can get out and you bloat very fast. You also vomit. You feel unbelievable stomach pains. It's like a trap. The stoma is a tiny hole. I had a blockage. I was really upset and wanted to go to the ER. My older sister is a nurse and had been visiting us at the time. My mom said the internet says to stick your finger in the stoma and just pull it out. We stared at her, horrified. No one was putting any fingers into a hole in my abdomen, into my intestines. My sister took me to the hospital herself. They gave me some drugs, and I went under. They removed it. Turns out no one told me. I couldn't have vegetables and fruits. I had carrots and strawberries the night before that they didn't go over very well. My mom is kind of a for wanting to do that for me. But holy no, Mom. Story 10, herbal supplements cure Parkinson's. All that Merkala horseshit. Guy lived as a human statue for 10 years, communicating only by blinking. I came in, took one look, and dragged us to a neurologist. 1 month on the appropriate meds, he started walking, talking, and living semi-independently. It still pisses me off mightily. His mother, who was his sidekick and biggest supporter and instigator of this lunacy, felt he was betraying his spirit, soul, mind thoughtfulness. She died of cancer after trying to treat it with herbs. Surprise. Story 11, an effective method of birth control is abstaining when the woman is on her period, because you can only get pregnant when the egg is being released. The second part is true, but the egg is released and available to fertilize during ovulation, which is in the middle of the cycle, not during menses. You should abstain during ovulation to avoid pregnancy. Story 12, I had a patient rub garlic and onions into an infected abscess and soaked it in undiluted bleach several times a day. He couldn't understand why it was getting worse and where his chemical burn came from. Story 13, I've posted this before, but I had a patient with aggressive prostate cancer come in and tell me he hadn't been following up because he was drinking grape juice with baking soda and that it was slowing the cancer growth. I told him, in fact, it was not, and the cancer was spreading. He said he disagreed and would continue with the juice. Story 14, cinnamon to treat diabetes. Patient came in telling my attending that she was pretty sure it worked because she checked her blood glucose and it was high. She took the 1,000 milligrams of cinnamon pill, and a little later her glucose went down. Now, if you check your blood glucose, the next step is to correct with insulin. So we asked if she just took the cinnamon by itself or with the insulin. She says with the insulin, then don't you think maybe it was the insulin that lowered your glucose levels? But nope, cinnamon must have done the trick. It's all natural with good ingredients. Story 15, not a doctor, but a vet assistant. Please do not give your dog an enema at home, especially not by using a turkey baster. It will end badly for your dog. Story 16, parents not getting their kids vaccinated. I just can't get my head around it at all. One of my colleagues, who is a pediatrician, finally said enough is enough, and any parents that wouldn't vaccinate their child would be discharged from the practice and would be given other physicians' information, because this particular physician would tell the parents, I will not play a part in putting a potentially very sick child in an environment where they may hurt many more children. I gotta say, I found that really OG. Story 17, the average specialty requires anywhere from 12,000 to 20,000 hours of training prior to being able to practice. And that's not counting subspecialization within a given specialty. The average idiot requires a superficial search without access to or understanding of medical research and a very small, very dangerous amount of information to believe they're better informed than their doctor. I'm all for patients being informed and making sound, rational decisions. But usually a small amount of information can result in an obstructive patient or family who prevents themselves or their loved one from receiving the best possible care. There are many good resources online to get yourself informed, but realize the docs are generally just trying to do their best. Example is the child of a patient who's a pre-med student, read about a disease on Wikipedia, and now thinks she knows the technical aspects of a Whipple in addition to post-op management. Ask us what we're doing and why I'm all for it. But don't hold us at every step when we're just trying to make sure your parent has enough fluid in his vascular tree to normally. Also, who don't vaccinate their children, source chief surgical resident at a large community hospital in a major city. Story 18, I work at a veterinary clinic, and this woman said that she read online that if she fed her dog only raw carrots for a few days, that it would scrape any parasites out of the dog's intestines. She brought in a fecal sample for testing, and it was 90 carat. Story 19, yesterday. Someone was convinced they got their strep wound infection from the air. I didn't ask where that logic came from, but I bet it had something to do with the internet. Story 20, not a medical professional, but my dad has been ill for 15 years, and my family and I have been his primary caregivers for the entirety. So we go to all of his doctor appointments. We've been through all of the stages of hoping something will slow down or reverse some effects of the illness. We've tried just about anything you can do yourself, any lifestyle change you can make to be healthier, any at-home techniques to make things better. We've tried it all. We grew up eating all organic, tried being vegetarian, all herbal supplements, using all natural cleaning supplies. We had an all-natural sauna build in our garage. Anything hippie you could think of, Dad was kind of a hippie. Anyways, the funniest thing I hear people claim they need to do waste money on is to go to a sauna strictly for the purpose of sweating out toxins. I never say anything, and I laugh internally. That's not how it works. Your body gets rid of toxins automatically every day, and the process isn't expedited by sweating profusely. Sweating can be very good for your skin. You can sweat out Dermatococcus bacteria that have been sitting in your pores, but it's not flushing out toxins from inside your body. If no one could automatically get rid of toxins without having to sweat profusely, everyone would be dead. Story 21, I have it the other way around. Dr. Google says this particular pill possibly has permanent side effects. Doc laughs it off, tells me to keep going. Now, I suffer from those side effects. Edit, thanks for the downvote. I don't even know what it means in this situation. Story 22, not a medic, but I once met a man who swore he cured his own prostate cancer by drinking 4 liters of water a day, laced with X drops of hydrogen peroxide. Hey, erase the science. Oxygen helps repair cells. Water has oxygen because it's H2O. Hydrogen peroxide is H2O2, therefore, twice the oxygen, twice the cell repair. Story 23, not a professional, but a volunteer who happened to get a lot of patient contact. Here's some of my faves: man who tore up his leg jumping a fence and decided to stitch it up with a sewing kit and rub it daily with lavender and honey. The honey attracted bugs while he slept. Girl who tried to cure a yeast infection with tampons soaked in yogurt and fruit juice. Not even cranberry. She insisted on lecturing me about the health benefits of shoving orange juice in an infected. Woman with atherosclerosis had been eating multiple bars of dark chocolate a day because it was good for the heart. People are insane. Edit format. Story 24, clinical psychologist in U.S. We get tons of people self-diagnosing adult ADHD, particularly around college finals. Aside from secondary gain stimulants can help with focus whether you have ADHD or not. Many people do not realize that anxiety and depression can seriously impact your ability to focus, but do not want to accept these diagnoses because ADHD has less stigma. Not to say you can't have both ADHD and anxiety depression, but typically you want to treat the mood issues first to see if this resolves the attentional difficulties. Story 25, had a patient who changed from drinking 12 Dr. Peppers per day to 4 liters of apple juice per day to get better control of his diabetes. He did not get better control of his diabetes. Story 26, my mother was doing a rotation at a rural health clinic in Texas during school. Whenever she would see active women, she would verify they were practicing safe. One woman confirmed she was very diligent about using a jelly. My mother asked what kind, and she replied with Smucker's grape. Story 27, not a medical professional. Just have relatives who try to push Dr. Google treatments onto me. I've been told that honey, salt, and baking soda for 3 weeks cures epileptic seizures. Also from the same person that I need to cleanse toxins by eating nothing but cabbage and drink aloe vera. Those can also help cure seizures, and I shouldn't take my prescribed AD medications because they are poison. My mother is wearing out her welcome on earth. Story 28, not a medical professional, but the women tell other women to do to avoid going to the doctor for easily treatable problems like yeast infections and UTIs are horrendous. Putting a yogurt-soaked tampon up, here's my favorite one. You're supposed to eat the yogurt, not give it to the fungus to eat and grow more. My other favorite is douching with apple cider vinegar. This is what imbalances the pH of your vagina, allowing the yeast to flourish rather than die. Take some meds, people. Story 29 as a dentist one. You can fix cavities with coconut oil thanks to Pinterest 2. Fluoride gives you brain cancer 3. No x-rays for me, please. I'm strictly no radiation, though they have a suntan. Story 30. I had a 20-year-old girl come to the ER because she thought she was having a stroke. She smelled smoke and looked it up online somewhere and decided it must be a stroke. I asked her a bit more about it, and she actually saw smoke too, i.e., she was near a fire. Story 31, my cousin broke his arm, and instead of going to the doctor, my grandma just put mud on it and said that'll put it back together. If you're ever an adult, do this, because the doctors will inject stuff and give you bad medicine. She's Mexican and somewhat old, but come on. Story 32, not drive, Google, but as a med student on my GI rotation, we saw a patient whose boyfriend convinced her that her Hep C medications were more dangerous than actually having Hep C. So she flushed them 6 months of pills to the tune of over $70K. She was back because she realized she needed them and wanted a new prescription. Yeah, good luck with that. Story 33, 3-month-old baby was not eating as much as she normally does, with a funny color, has been spitting up a lot. She breathes really fast, her heart rate is very fast. Mother somehow got some kind of organ failure. Took her to the local urgent care ED combo that we have, gave baby fluids for possible dehydration, did all kinds of tests. Everything negative, baby was eating fine at ED, didn't spit up, was vitals were within normal limits. Argued with us, saying that it was too fast. Her reasoning was she Googled normal pulse and rest for adults, thinking they were supposed to be the same as babies. Got discharged, we took her home. Back in the morning for the same. Wants to be taken to our main hospital an hour away, because it has a PEDS floor. Same gets discharged, taken back home. Calls 911 an hour after being taken home, for the same problem. Okay, well, where do you want to go? Children's Hospital of Philadelphia. Know that it's too far. We can either take you to Virtua or Cooper. I want to go to CHOP. Ma'am, CHOP is an hour away. We can't bypass 2 hospitals to take you out of state. Refusal. Goes to the urgent care ED, gets admitted, demands for CHOP to come and pick up her child from that ED. Decided to not get involved and just stay in my little closet. She disappeared. Wherever she went must have not worked, because she was in the ED again 3 days later for the same again. TLDR had a woman call 2 hospitals and all their staff the most incompetent people on the planet, because who on the world would lie on the internet? Story 34, read answers, and wonder how it hasn't been shut down. An old guy I met had earwax blocking his ear canal. Someone told him hydrogen peroxide would fix it. He used an eyedropper to put 10H2O2 solution in his ear. He subsequently went deaf in that ear. Story 35, I think I mentioned it before, but I used TI, belonged to a web forum for spinal cord injuries, and once upon a time, there was a post there all about how we could heal ourselves if we just ate more fish, because fish will drive the toxins out of our bodies. Yeah, my spine isn't broken, it's those toxins. Story 36, not me, but my so is a PA, and she told me of a diabetic patient had come in because his blood sugar was 400 or 500 unknown unit of measurement, and he said he stopped taking insulin because he saw online he could take cinnamon instead. Story 37, a friend of mine tried curing a UTI with acupuncture. It didn't work, and she ended up going to a doctor and absolutely flipping out about having to take an antibiotic, like she had trouble sleeping. She was so afraid of it being toxic. Story 38, not a medical professional, but I have met someone who read on the internet that a mixture of various blended household plastics like water bottles or trays would help you have more stamina when exercising. I really hope they didn't try it and have no idea why they believed it or what connection they made with plastics to stamina or anything for that matter, but I guess I'll never know. Story 39. This is more the opposite, but my dad is a doctor. There was a patient that one of his colleagues' country was having trouble with. No one could determine what was wrong with him. They asked my dad for advice, so he said what he thought it was. The patient sadly ended up dying not too long after, and they were finally able to determine what it was. My dad was right. How did he find his answer? He typed the symptoms into Google and clicked on the first link. Story 40, physiotherapist here. We get plenty of patients coming in after the stuff they tried themselves has ended up making them worse. It'll frequently get patients in complaining of back pain who have been doing sit-ups to try and relieve it. Most of these people have discogenic pain posterior derangements and make themselves a whole lot worse with sit-ups. It'll also get patients who have given a specific exercise program to go home. Google more and do those as well. For instance, had a post-op ACL patient go home and start doing plyometric exercises because I'd seen on Google that that was what you were supposed to do, despite the fact that ID spent the last hour talking him throughout he rehab progression, healing times, etc., and had been very clear that he wouldn't be able to do that kind of stuff for at least another few months. He ruptured the graft. We'll get plenty of people who swear by absurd diets or homeopathic remedies, and are sure these things are doing more for their injuries than myself or their doctor are. Some of the more frustrating patients are the ones who self-diagnosed and then come in demanding a specific treatment. Most of the time, their diagnosis is wrong, as they've just read a couple of symptoms, usually along the lines of pain around this area, and occurs most frequently within insert very broad population group, and they'll refuse to accept that it might be something else. They're also the most likely to demand alternative, inappropriate, as in not appropriate for their injury or just useless treatments. Plenty of people coming and demanding manipulations when not appropriate, demanding therapeutic ultrasound when it's a load of, or demanding incredibly obscure or weird treatments. Story 41, I had a patient require emergent liver transplant because of liver failure caused by herbal supplements. I'm guessing the internet told her that herbal supplements were natural and therefore safe and better for her. So scary. Story 42, Mamotech here. I've posted about this before, but patients who come in and won't have mammos and say they use thermography or insist on screening ultrasound. Sorry, ladies, but these do not show calcifications. Sono is great for surveying masses for cysts versus lesions versus fibroadenomas, etc., but doesn't see calcifications, which are one of the earliest signs of ductal carcinoma, which is 80 of all breast cancers. I get it, mammos, but we wouldn't be doing it. You wouldn't have so many people so passionate about helping you through it if we didn't have good reason and research to back it up. And thermography is the biggest crock of around. Even if it could detect cancer, by the time it showed anything, it would be too late. Ladies, get your screenings because cancer hurts a lot more than a mammogram. Story 43 points had a bad ulcer on her eye and decided to treat it by using breast milk. She was using breast milk eye drops on her eye. We saw her too late, and she went blind in that eye. Story 44 here is a reverse of this. I had a doctor years ago decide that a panic attack was being caused by a bad diet after she sat there Googling the ingredients of my dinner the night before. Story 45, conversely, I've had quite a few doctors openly consult Google during appointments. I've seen them click on the first sketchy forum result they find and make dosing decisions based on that. As an information professional, seeing this happen is the worst. Story 46, not a doctor, but this woman in my office brags about how she doesn't have a microwave in her house because she doesn't like to poison her food with radiation. I don't speak to her anymore. Story 47, I don't know if this is a Google thing or just run-of-the-mill cluelessness, but I work vet clinic and we had a woman come in today to drop off her pet for the day. She gave us a written list of questions for the doctor. One of the questions was asking if the topical flea prevention medication was inserted anally. Story 48, most of my patients don't care enough about their personal health to bother looking anything up. They just wait till they can't breathe, have diabetic ulcers all over their legs and a horrible heart. Then they call us, and that the stupid doctors don't know what's wrong with me. I love my job, but these people annoy the out of me. Story 49, a mom once brought a child in with a terrible ear infection. When we looked inside, she had put olive oil and a garlic clove into the ear for several days, allowing the ear infection to get worse and worse. The inner ear was filled with and severely swollen. Story 50, I had a patient come to my urgent care clinic because he had cut himself. When we unwrapped the bandage he had applied, we saw that he had coated his wound in rock salt. I have no idea why. When I asked if it hurt, he looked at me like I was the idiot and said yes. Story 51, does anyone else get a stabbing cringe feeling in the back of their head when someone confidently says I read online that, but then says something that contradicts the accepted truth? The ability to get instant information has made people so gullible and stupid. There are lots of facts out there, but it's also your responsibility to check the facts before believing them and spreading them on like you're a scholar in the field. People search, but neglect to research. Story 52, some great stories on here, but medical professionals aren't all geniuses either. I had one doctor tell me not to bother taking Mucinex because the main ingredient, guaifenesin, was just an ingredient the FDA adds to cough syrup to prevent people from getting high off of it. Story 53, med student here on placement, had a 58-year-old man who had been having diarrhea and blood in his stool. Doctor wants to do a colonoscopy, have a look, and remove any polyps, potential cancer. Patient refuses. Doctor course asks why, as it is a very safe procedure. Patient, I don't want the air getting to it. You will poke and prod, and it will get air in there. I read that the air spreads it around, and it grows on oxygen, so the cancers will get bigger. Story 54, I have a doctor friend. He was active duty military and is transitioning into the civilian world. He's having a rough time with Google, and patients he no longer outranks. Guy shows up with a print out of an exotic African disease he claims to have contracted. Have you been to Africa? No. Do you know someone that went to Africa? No. He had the flu. Story 55, bad advice is all over the internet. Sometimes when I browse forums that asked a pretty specific question, I see people post some flat-out wrong answers. It's almost always answers too. Story 56 connecting any one symptom they have to a number of diagnoses, typically on an extreme end, while in fact their diagnosis is no greater than just the one symptom they have. Story 57, if you shove enough tampons in your vagina, it works as an absorber and you won't get pregnant. This was done by a prostitute whose clients didn't want to use condoms. Story 58, hadn't been breastfeeding the child. Well, that's not so bad. There's formula feed the child a mixture of cornstarch and water because formula was too expensive. Good gods, how did she remember to breathe? Story 59, how do you even deal with that? Do you have to call CPS for mother is a complete idiot, or do you really have to just send them on their way? What do you even do in that situation, apart from slamming your head against a brick wall? Story 60, that's on the same level as people not vaccinating their kids because they think ITLL cause autism or whatever, but wonder why measles is coming back. Story 61 in Quebec. When you have a baby, the government gives you this very useful book that's a sort of owner's manual for babies. They should do this everywhere. Story 62, wife is an OBS nurse. Home birth disaster patient came in. Good old internet. In summary, ride around and keep your legs together to get the baby to change positions while delivering. Good thing you had your doula weekend certificate. Now this baby looked a lot like Husha has CP. Ugh. Story 63, is this in the US? Is there no system to monitor and support families with new babies? In Britain, you'd have a visit from a midwife or health visitor to check baby was feeding okay and regular weigh-ins. Story 64, in the 1940s, my grandmother's was unable to nurse. She fed my mom corn syrup and canned milk. All her teeth turned black or fell out by age 2. She has had a lifetime of chronic diseases, but still kicking. Story 65, I've done a lot of interneting in my time. I have yet to see anything that says breastfeeding is bad. Where in the world on the interwebs did she go? Story 66, WTF, how could she be that stupid? And props the baby for surviving 2 weeks of water and water thickener. I don't even think ID put up with 2 weeks of starvation. Wow. Story 67, my friend was a nurse who would do home visit to family in needs. One day, she visited a woman and found out that she was feeding her baby coffee. The baby bottle was full of cold coffee. She immediately called the cops. Story 68, it is likely that this person wasn't just an idiot, but a Scientologist or a friend of one. Hubbard didn't believe in breastfeeding and instead advocated for some sort of barley mash water as baby food. Story 69, well, it seems like just confused information. Breastfeeding can cause slightly higher bilirubin levels, like milligrams higher, but breastfeeding also causes looser stools, assisting the baby flush the excess bilirubin out. Story 70, when my mother worked at a vet clinic, a young couple came in with a puppy to ask what they were supposed to feed it. They had a baby with them in a pram, and my mom goes the same thing you feed a baby. And as she looks in the pram, she sees the baby bottle filled with something brown looking. Upon talking to them further, she learned that the baby was drinking coffee. These poor kids had literally never been taught what you were supposed to feed a baby, so just thought you could give it anything. Mom had just had my brother, so had a heap of formula that she gave them and told them how to mix it up and feed the baby. They kept coming back to her for a while after that for parenting advice, because they had no one around them they could go to. Story 71, man, that's weird. I wonder where she read that. I hope she got a proper education about feeding that was balanced and not biased toward one or the other. Story 72, my sister's father-in-law was shocked that my sister was breastfeeding instead of giving the baby milk mixed with sugar. Apparently that used to be a thing, or it just explains why my brother-in-law is so fat. Story 73, due to some weird redneck happenstance almost 20 years ago, I ended up sort of rooming with my then-husband's ex-MIL. Anyway, I just had my first child, very healthy baby who I was breastfeeding. She proceeded to tell me how that was nice and all, but when she had her daughter who was allergic to everything, she had to feed her Jello water most of the time. But she was way smarter than my daughter because she was speaking in full sentences at 5 months, so obviously my breast milk was in no, as opposed to Jello. Said daughter, my ex-husband's ex, just to be clear, ended up with lupus and all kinds of terrible stuff in her 20s. TLDR, moms can be weird. Story 74, severe jaundice, which at birth is normal. The mother, though, hadn't been breastfeeding the child because she read on the internet that breastfeeding is bad for babies. Perhaps she got confused with breastfeeding jaundice or breast milk jaundice. It's one of the few conditions where breastfeeding is a risk factor, but formula feeding isn't. Story 75, my best friends in-laws thought that breastfeeding was only for poor people and were mortified that she insisted on breastfeeding. A coworker's wife gave their first child skim milk, and he almost died. Story 76, Jesus Christ. The sad part is if she had given the kid formula, the jaundice would have gone away. My son had it bad enough the doctor had me take him off breast milk and strictly formula and 2 30-minute sessions of sunbathing a day. He went from having it high enough that he was close to needing a trip to the hospital to it being okay in about a week. Story 77 in 6th grade. I shattered both my kneecaps. The military hospital, though, kept telling me I had ACL tears because they didn't bother to actually look at the x-rays they took until I had my 6-week checkup, didn't even spring for a wheelchair. I had to roll myself around the house with a computer chair and a broom handle. Story 78, we called it vitamin and Motrin in the Air Force. I tore the cartilage in my rib cage and was prescribed Motrin, no painkillers. When they ask you pain 1 to 10, you need to answer 10 for painkillers. I answered 6 because I was comparing it to the pain I felt when my girlfriend cheated on me. I was an idiot airman. Story 79, my university health department was like this. It didn't matter what was actually wrong with you. You got Tylenol, salt to put in warm water for a gargle, and some Vicks Vapor Rub, and they'd always ask you if you're pregnant. Nurse, I think I sprained my ankle. Okay, are you pregnant? No. Are you sure? When was the date of your last menstrual period? It's not like they were going to take an x-ray or do anything other than send you back to your dorm with a packet of acetaminophen anyway. Story 80. So, hey race, an incident that happened to me a few years ago. I've been feeling sick. I know something is wrong, and I'm coming down with it. It's some sort of flu-like symptoms. I've had pneumonia before during my time in boot camp, and historically my immune system is slow to respond. On top of all of this, we're in the middle of a pre-deployment training regimen, and I really can't afford to be knocked out by an illness for the next week and a half while I recover without medical treatment. So, I go to the doctor. In fairness, this person is an actual doctor in the civilian and military world, not some random corpsman. Finally, after a series of tests, she tells me, this I'm paraphrasing a little, you're the 3rd person I've seen today with these symptoms. It looks like a viral or bacterial infection. Okay, well, what's the treatment? Nothing, I'm sending you back to work. What? Stares blankly, doc. I have a bit of a weak immune system ever since my pneumonia. Normally, if I have a bacterial infection, you'll need to give me an antibiotic shot in my cheek about once a day or every other day to get my immune system kicking. Otherwise, I might spend the rest of my time here sick. Yes, I understand that, but I don't want to start handing out antibiotics and have the disease adapt to the drugs early on. Pretty skeptical. Okay, so then shouldn't I at least be put on limited duty so I cannot infect everyone who's already healthy? No, you'll be all right to work for a little while longer. Come back in 3 days. Well, I do exactly as the good doctor said. Predictably, over 150 people got sick with this same illness within the next couple days. I returned in 3 days in an absolutely garbage state and got a light-duty chit and some small antibiotic pills. Also, as predicted, I was out for about a week and a half because I know how my body works. TLDR, this was the first time I've ever had a doctor tell me that they wouldn't treat me because they wanted everyone else to get infected first. Edit. Noticed I didn't mention the context originally.